10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
So, good afternoon, everyone. Once again, my name is Siddharth Stephen, your host for the day. And once again, we are here live with our wonderful participants from all across India yet again. These are your champions that you selected on the grid on the first round, and now they are finally over here in the second round. And the best part is today we are honored by Dr. Zia, who is with us. He is the operations head of Benzara. He will be actually moderating the group discussion. So over to you, sir.
So thank you so much, Siddharth, and I welcome again all the participants. And today is without taking much time because they are quite eager to put up their points. So let us begin with the topic, and the topic is a very recent one, but that's going to be a great matter of debate in the coming times, that whether COVID-19 pandemic, which may result in a mental health crisis, because this is something which is now, as we are getting over the lockdown, but still, the economic crisis that it has created, how the people has been shut in their homes for like 80 to 90 days. There is a continuous economic instability, economic uncertainty. People are having, unpaid EMIs. In there are certain n number of things that are risen up. So this may, result in some sort of mental health issues it has creating, because initially when psychological studies said that in the first lockdown of 21 days, the mental illness cases were up by 20%. So this is going to be a debate top thing which is going to be there. So I'll request that please we'll start with, like, we'll have an opening remark from everyone, you're having just 1 minute to complete it, just 1 to 1.5 minute, complete your opening remark, and then we'll move on to a discussion. I'll start with Rohit, that you can come up with that.
We have seen that if fear, worry, or stress are normally responsive to any threat, sir, at a time when we face with certainty or certain or uncertain fear, we have seen that, sir. So obviously, sir, we have know that the virus which is unseen and the cases of that which has been increasing day by day. Normally, the mental or any possibility of threat which a person might think that they may have will come into face, that will lead to mental issues, sir, mental problem. Because obviously, sir, they will think that my beloved one or me myself will come face to face, and he will think more and more, and this will ultimately lead to, sir, mental problems, sir, mental issues. So according
Yes,
to me, sir,
moving on
obviously
to,
the COVID-19 will lead to some issues, sir, health crisis, sir.
yes, moving on to Rangeet, your opening comment, 1 minute, in 1 minute.
Yeah, sure, sir. Sir, as Rohit talked about fear and stress, sir. So, due to this COVID, the mental health crisis is faced by every age group, I think. It's faced by starting from a 10-year children to a 60-year-old senior citizen. Everybody is going through some or other mental health crisis, which is affecting them, right? Mostly the fear and anxiety, sir, that if someone may get affected. And not only the age group, if we divide them according to the professions also, they are also affected, especially the frontline workers, like the health workers or the civil service police, those who are working outside. They have they have anxiety that they are taking all the precautions, but whenever they are coming home, they have a fear that they may infect their family members also. And other professionals group like businessmen, they are also affected a lot. So if we see this mental health crisis is not depending on some like COVID only, it's not depending on some financial status of a person. Like a labor is also facing a mental crisis as he don't have a job, nobody is hiring him currently, and also a rich businessman is also going through a mental crisis as his business is also stuck
Exactly.
somewhere and he is unable to grow it. So we all are
Yes.
facing in some another way.
Yes. Ritesh, your opening comments.
Hello, sir. Sir, I'm in flow with the motion that COVID-19 pandemic lead to mental health crisis. Describing this, first of all, I like to give the introduction regarding that. The COVID-19 pandemic, what is it? It is a rapid spreading disease, has given rise to a severe of negative cognitive response and emotions in the population at risk. First of all, how it lead to mental health crisis. During the lockdown, as the lockdown period start in India, nationwide sudden bans of travels, lack of work lead to no financial means, taking care of daily food expenses, quarantine rules. All are sudden result in high level of anxiety. Not only mental stress, it also lead to depression, anxiety, and panic disorder.
Fine, fine. So these are the opening comments from Ritesh. Is Isha, you are if you are here, is if you can we can see you. Your opening comments on the. I think we have lost her. So most of all, for you three of you, if she joins, we'll put her. I think. So, what do you think that it is going to be now? There are people in in European nations. There is a study, and it says that it is this pandemic may lead to another pandemic, which is going to be for like the mental crisis, the mental health crisis. And India also, it is not just the the financial crisis, like people children are facing that because they haven't been out for like around 100 days. They are inside their homes, they haven't met their friends, they haven't met, they have lost their personal space. So what do you think that, as per, if I put the discussion on the line, that on the grounds of age groups, what would be the impact of COVID-19 pandemic? It's not just on the fear of the disease. It is when you're coming in, and after that, when we will go out, what will be the mental status of the people? So if you can have some discussion over that.
Sure, sir. As you told the age group, like 10 year children, he is not going outside. Like he used to go to school or go to play outside at the evening. He is not going outside. Like the adults, like us, adults or teenager, we are good with technology. We are connected to friends through WhatsApp or Facebook. But a children is not connected to that particular social networking, so he is unable to connect to them. And you can another thing that the children are facing is the parents are also going to through depression or anxiety. So some or other way that depression or anxiety is coming onto the children in way of some physical abuse or violence that the children
Okay,
are
this
seeing.
year.
And
Okay,
Sir, I want to add one point on this. As
yes,
my
go ahead.
friend said, that children nowadays not connected through social medias, but I think that I have seen many children who are getting connected to social media when they are nearly 5 or 6 age. They are very smart,
Okay,
uh, and I think that this will lead as they are in isolation. The one thing that children tend to do, they spend more time in mobile phones. They hardly do
okay,
some physical activities. So I think that in that way their physical growth might not be possible during this lockdown period, and the mental health also, due to sticking upon the phone or the laptop, it will restrict one and point, sir. For the
okay,
children, for growth, outside exposure is very necessary, sir.
okay.
And we have we
Ritesh, if we can, wait just a second, I'll come back to you. Ritesh, you want to give some input in that?
Sir, I want to add something. That is, when COVID-19 ends, and when the effects of COVID-19 virus end, there are five things that always remains in people mind, or in whole population mind. That what is the recovery rate? that is in how much what is the percentage of that is going to be there in after COVID-19. And second thing that is will, sorry sir, am I still
It's fine.
infected about after recovery? That is when I got recovered from COVID-19. Then one thing that always remain in people's mind that will I get affected by COVID-19 again? This is the second thing that always remains in people's mind. And third thing,
So,
how long might
yes.
immunity to the COVID-19 last? Uh, One thing that if the immunity or the COVID-19 vaccination came in India or came in or came in or scientists developed this COVID-19 vaccine, then the second thing that come in mind that how long the immunity of the COVID-19 vaccine lasts, and
So
third and
this is what I believe, Ritesh. Ritesh, what you are pointing out is the only stigma that is just because of COVID. But I believe a larger problem is going to be unemployment, the fear of losing job, how that will impact the mental health. If you can come on that, like I'll start with Rangeet in this on this point.
Yes, sir. It's not going to affect. I think it has started affecting, right? The small businessmen, their shops have been closed for like 2 months, 2 to 3 months, and that is their source of income. So they have to depend on their savings. So they have exhausted like 60% of their savings. So uh, there is a anxiety or grief in them that how will they make up, how the things gonna change,
Okay.
what are the new guidelines they have to follow, and again the new pass outs like the graduates or the postgraduates who are going to pass out this year, they have a fear that will the companies hire them. On the other hand, the company is dropping their employees at a high level because their profit margin is going down. So I think so this is affecting a large, means all the working professionals or the students who are going to work, like they all are affected, they all are in a trauma that what will happen next. So, and it's not that they're again in trauma, people are fighting it in a good way. The yeah, starting from WHO to Indian government have provided guidelines to how to handle with mental stress, parallel how we handle with COVID. So the government is also concerned, we are also concerned, and
So,
people are.
yes, means one thing I want to, before I move on to Rohit for his comments, don't you think that unemployment, apart from unemployment, this may lead to other social problems, let's say domestic violence or alcohol abuse?
Yes, sir, certainly, sir.
Rohit?
Domestic violence.
Yes,
Sorry.
sir. I would like to add Rangit point only. As we know that the middle class population is very large, and the capital of the middle class people had been exhausted during this period. So there will be no demand, and due to which the factory can't be started their production, sir.
Okay.
And secondly, factory also can't start producing because of the migrants. They went back to their own home, sir. And domestic violence and sir, substance abuse will be more because there will be nothing to do, sir. In the If a person is nothing have nothing to do, obviously he will go for the substance abuse, sir. And as we know, sir, the person who don't have anything to do, he will be very stressed, and automatically it will, sir, lead to domestic violence, sir. Some query will be with the sir family, sir, or wife. And we know that, sir, is common thing in that if you can't do anything to the world, men easily beat, or husband easily beat their wife, sir. You have seen that, sir. It's a very fact in our, sir, Indian culture, sir.
Yes.
There are many cases of
Um,
this domestic violence cases due to unemployment, sir. And
so,
sir,
Ritesh, you want to come in? Rohit will come back to you first. Let us take some input from Ritesh,
okay, sir.
if he can come in. Ritesh, are you connected? I think Ritesh is also having some network issues. Moving on, Rangit, you can come in and put in your, comments and your views on this. Whether this is going to be a bigger social problem, pandemic is on one side, the disease related stigma is on the one side, but the impact of social, the social impact, the family impact, when children will go back to school, when we will go back to our offices, when we'll use public, transport system, how easy or difficult that would be in the post lockdown or the post pandemic time period. This is the main topic that we are discussing here. That is, after this, is there any a huge problem waiting for us as a, whole world, as a society, of mental issues, mental health, because we have seen lots of cases of suicides that have been committed in this time period. People have lost their balance of the thoughts, the balance of thought they have lost. So you should come in with some inputs on that.
Uh, yes, sir. Hello.
Yes, you're audible, Rangit.
Yes, yes, sir. So I think there is both side to it. Some people are got indulged in the violence or got addicted to alcohol or smoking to reduce their stress. Or there, like you can see, there have been, we are not acknowledging that, but there have been a huge pressure on the housewives also, because the maids have been stopped coming. So the whole household pressures have on
Yes.
with them. So they are handling the household chores and so some families are using it in a positive way, like they are spending time together. They are trying to solve issues, previous issues which they are able to spend time together. And some families are means who are unable to control their means have control on them, losing their control. They are getting indulged toward violence. And as a whole, the world is facing this problem. Not only country like means developing country like India, but the developed countries like USA, Russia, this kind of things can be reduced. Guidelines are provided, and those people are accepting that, following those things. They are, I think, in a better way, like uh, working out at
Okay.
home. Or if someone has any problem in, I would like to focus on this fact, sir. In India, we see this mental health issue as a point of shame. People don't like to approach psychologists in those cases.
Yes.
So or if the issue is chronic, then we should go to a doctor. uh, this way it can be
Yes.
acknowledged and
Yes.
it can be
Exactly.
controlled.
Exactly. Rohit, you want to comment with this? Because
No,
in India, what Rangit pointed out, that yes, we don't deal
Yes,
with
sir. But
mental health in a very open-minded manner.
sir, we don't like to discuss this issue. Long recently, from we have known that the recently one suicide had been happened. The Bollywood star had committed suicide. After that, only the media, the everyone is started talking about this problem openly. Before that, we don't used to speak about this. And as you talk about the sir, social issues which might come due to this is there, as you know that India is a very sociable country from last from when it started, sir, or from when it had been come into form. But I think now it will change very rapidly, sir, because
Okay.
some days before I have read it one article that uh, one of the person who had been recovered from this disease had gone back to his home, but people are afraid to approach him because of they think that
Exactly.
they will get infected from that person again. People are not taking the fact that he had recovered, he is immune now. Just go India is in India, one thing is that whatever there is in social media or in WhatsApp group, people easily take it as a fact, they don't cross check it. And I think the marriage which is happening nowadays, the persons are very less, hardly 20 to 50 people. And this before, where there is to be 1000 2000, the social gathering which is to be happen before the pandemic and after the pandemic, it will get affect very will have very large effect, sir. And
Fine. So before we move on to the next, before we end, just one I will put one from your side, that we know from your views, I can understand that you all know that yes, there is a mental health crisis which is approaching us in this pandemic era. What steps either we should take as a society? We are not. I'm not talking about the government, but what are your views that what we should do as a society to counter this, to tackle this problem?
Sir, firstly, I think the government. I will point one thing. The government must allocate some fund to this mental means, sir, for hospital or something must be fund must be allocated to hospital or the health ministry for tackling this thing. And as we as a person, sir, you must cross check every fact which we come across, sir. Just we must verify it. If some person is going through some depression, we can know by many clues, sir, that he is going through depression. Firstly, sir, I have read it somewhere that if a person sleep order his means or sleeping time had been changing, that he might have been going some problem, or if the person is not sleeping, then he's or thinking too much, or his eyes are red, then he is thinking too much and going through some mental issues, sir. And if we know someone, then we must go approach him and we must talk and try to release his mind from this all sort of things, and we must try to sort out what the
Okay.
main problem. And even the psychologists had advice, if someone have been having some mental issues, the person or the family must give more time to him, talk to him, so that the depression might go away. By person will think
Fine,
that
fine,
at
fine.
least he will have someone to talk
Yes,
to, sir.
yes, yes. Rangeet, your input on this, that what we
So I
should, because we know what from I can get from your views that we know that yes, this mental health crisis is approaching. What we should do as a society?
So, as a society, I think we should stand together. Like we should help each other. I know means there should be an bound feeling among us that if somebody is affected, yeah, we will go on with the guidelines. We will not touch him more, but we will give him that assurity that we are with you. I have seen in many cases around that if some home is getting affected, people are like treating them as untouchability. They are going means we should help them in a proper way, like providing them with foods or the things, the daily essentials they require, provide them with a safe distance, give them moral support that yeah, we are with you, nothing will happen. If anything happen, we are always there to stand for you. Friends and family must come together, not if not physically possible, then through mobile phones or through any connectivity. They should be around each other, support them. And it's not that they are not doing. Many NGOs, many youths are working towards the society, providing meals and supports to the poor people around, collecting funds. And those are the really good things that as in India Indians we have done towards the society. And there,
Yes,
and I think government
yes,
also should
that's
give some awareness. People are less aware, so through media there should be awareness, that proper awareness. Like too much news
see,
channels
here
there.
I want to come in. I want to come in before we take your concluding comments. The the issue of mental health is not just of the person who has recovered from the the disease. It is not just about the people. It's about the whole as a society what we are going to face. We are going to face like I told in the my opening remarks also that it is not just the people. It's about your economic hardships. It's about the indebtedness. It's about the job security. It's about the children who are going to the schools, who will go back to the schools, who are away from their friends for like more than 3 months. It's now 4 months, and we don't
Yes,
know how
sir.
long it will take. So on these points, on these mental health are not just of any individual or any particular group of people. When you I want your concluding remarks, your final comments on the whole problem as a whole. That are we going towards a mental health crisis? Because especially in India, we don't take mental health issues very open heartedly.
Sir, as you know that now the children are mostly on phones and all. The after this pandemic go away and they after going to school back, sir, they will most importantly they will face a problem of socializing with one another, sir, talking to one another. They will. they will find very hard to talk to each other and keeping their point in some in front of someone, sir, because for a long time they have not been talking to each other, sir. And sir, as you talk about, sir, apart from the person who got affected, there are many sir, they are migrants, sir. As you talk about, sir, jobless, so who are jobless, obviously, sir, due to jobless, the the mentally they are not secure, sir. They are thinking that what will happen. They are not um, they know, they are uncertain about their future, sir. The
Okay.
so it's very important to uh, important by to give them some security or sir some what what is not.
Yes, yes. I'll fine. I'll move on to Rangeet if your concluding remarks in about 1 minute.
Yes, sir. So, sir, as a whole, we have to understand each other's problem. We have to give some time understanding this person in front of us, what he is facing. Like the mission of going local is also a good initiative to boost the economic crisis, sir. Yes, one of the main thing affecting the mental health crisis is the economy. If the economy is good, if people are getting their salary at time, if that thing has been at a better place, then the mental health crisis will certainly reduce. So I think we should means go ahead, help each other. We should hire, means if we are capable that we can pay a little more to the laborers, those who are working, then we can always go ahead and do that. These small steps that we should take. If we should give time to the children and understand they can't share easily. Like if adult can easily share his problem if necessary, I think
Yes.
parents should give time to the children, understand their problem, because they won't know that they are going through a mental health crisis. It's our duty to understand those. And same with the old
Yes.
age people also.
Exactly. Exactly.
We have to understand them. They have the fear that if they are already having some previous health issues, and if they want some help regarding that, they also can't approach the hospitals, right? Because the hospitals, whenever people are going there, they are taking every case as a COVID case. They have a fear into
Yes.
touching them. In that way, we have lost few lives. So we should tackle
Yes.
that
Yes.
in a positive way. We can do
So
it.
we should tackle that. Fine. So I think we have only two contestants in between. We lost connection with two people, but opening remarks from I believe Tesh was also it was nice to hear him. From my part of concluding, this whole discussion is that we should take care of, first of all, if you have to come out of this as an individual, and we should spread the word because we are going live also, and other people are also listening to this, and it's our social responsibility that we should make people aware of this, because we are well aware of the virus, but now we need to get aware of the mental and the psychological issues they are awaiting for a whole society. So first of all, we should limit the news, and whenever you are listening to any news, do please do a fact check, because this is something which is more, every morning you wake up that today 15,000 infected, 400 died. No, this is something which the first thing that you listen in the morning. So always try to filter that part. Stay well connected with your families. More, speak more up. You don't like anything, if you want to go out, ask your parents. If you're, not an adult, you're like below 18, and if you can go out, if with all safety measures, take a walk, keep yourself physically active, and try to be self motivated, motivate others. This is the only thing that we can do, or else that's true that if we'll not take care of these things, apart from taking safety measures to prevent the COVID, we will definitely may head towards a mental health crisis. So this is my input from the whole discussion. Over to you, Siddharth.
Great. So, thank you so much, sir. We this topic, as you rightly mentioned, this is really the need of the hour. To be very honest, the discussion happens every single day, and we are somewhere around the corner, we just come back to this very topic. How should we actually cater to the mental health at this, specifically in this pandemic? So coming to the same thing, Rohit, Rangeet, few, I believe two other participants also had some connectivity issues, so they couldn't really join us. But Rangeet and Rohit, thank you so much for your time. Thank you once again for participating in the grid once again. Dr.
Welcome,
Zia,
sir.
once again, thank you so much,
Thank you
sir.
so much.
It is truly a
Thank you so
pleasure to
much.
have you on our platform. We are loving
My pleasure.
your,
Thank you
your
so much.
availability. And
Thank you
this
so
is
much.
now straight away a message to the audience. So, guys, now is your time. So, basically, the once again, vote for your favorite participants, guys. As you did, you supported them, you voted for them. So now they are right here, and now is the time again that I would request you to vote for them. Make your favorite participants win. Make your favorite people, walk up the ladder of the Great Indian Championship. Make them win the competition, and make them, idolize them as to where they, you would like them to be. So, concluding on that, if you would like to vote for them, please vote on the comment section below. If you really like the group discussion, the points that were discussed, give it a big thumbs up. If you liked our channel, if you, so give our channel a big like. And apart from that, do share it with your friends, families, even the participants. I would request you guys to share it with your friends and families so that, you can get the maximum number of votes as you can. So once again, thank you so much to everyone who is viewing. Thank you so much, Rohit. Thank you so much, Rangeet,
Thank
for
you, sir.
being here.
Thank you, sir.
Welcome, sir.
SafeJob is an AI-powered job preparedness platform. It is the latest edtech platform released by Safe Educate.
BFSI sector in India will need an additional 1.6 million skilled workforce by 2022.
The report says that people with the right skill set are very likely to get jobs as the service desk analyst and technicians.
The roles of logistics are to provide the right product in right quantity, at the right place, at right time, in right cost to the customer.
E-commerce sites have become more popular these days, due to which demand of data entry services has increased.
Customer service executive plays a critical role in providing an interface between the customers and the client's company. There are various career options available in this industry.
It is a platform for students, by students.
This is your dost Smart Sid.
I'm Paras Narula.
My name is Varang.
You are watching SafeJob, and I am your host, Grace.
Be a part of the SafeJob family, because as we say, job hai to rob hai.